Hello, everyone. Dr. Nick Verma here with another edition of Things I Didn't Learn in Med School. This week, I had several incidences where patients could have benefited seeing a musculoskeletal health expert sooner than later. And they were either misdiagnosed or misdiagnosed at the beginning. They might have had the wrong treatment algorithm given to them, or they might have ignored their problem for so long that they now have very severely limited options of what might be beneficial for them. So I'm going to go through a few cases of this week that kind of tie this all together. And I'm going to start with the individual who actually, in my opinion, did all the right things. He had this pain on the right side of his body and it was bothering him underneath the rib cage. And with that, he went to sports medicine doctors. And the sports medicine doctors diagnosed him with costochondritis, of inflammation of the cartilage of the ribs. They might have suggested that it was a fractured rib. Now, this individual is a former athlete and he's had fractured ribs before, and he said this doesn't feel anything like it. He was misdiagnosed with multiple things. After about 5 to 10 minutes of evaluation, I put my hands on him during my physical exam, went through some range of motion exercises, and I identified that his problem is probably stemming from upstream, meaning more from his back than it was from his ribs. And that was just a referred pain pattern. Now, I think that's a big highlighted point that people need to be aware about is if you're not getting anywhere with the diagnoses that your current physician is giving to you, maybe it's time for a second opinion. And I'll give props to this individual. He actually found me on social media and reached out. And within 10 minutes of him being in here, he's like, "Thank you so much. You've explained everything way better than anyone else has. And it makes a lot more sense to me what you're explaining." Now, I'm not saying I'm perfect. I'm not saying that I know everything. I've seen a lot and I've been around a lot of very smart people, and I continue to learn from very smart people. And sometimes specialists included get so pigeonholed on one small detail that they forget to look at the bigger picture. And I looked at the bigger picture of the individual, and I think we have a better treatment algorithm for him, and I think we're going to help him out. So that's just one example. Is if you're feeling like, hey, I'm not really getting anywhere, I really need a second set of eyes, maybe someone that has a little bit more expertise in this area, maybe that person can help you out. Don't get me wrong. There's been situations where I haven't helped patients out that they've come to me with, "Hey, you're my last hope," or "I've been to all these other doctors." Sometimes I still can't figure out myself, and that's partially on me. Maybe I'm not read enough, and partially on our diagnostic skills and diagnostic tools that we have, imaging and nerve studies and ultrasound aren't as advanced as we'd like them to be here in 2026. So again, I think that's one really important time that's important to go look for someone else. Another individual came and they actually had multiple steroid injections into their shoulder. The number is very important here because they had 7 or 8 corticosteroid injections in their shoulders. Now, if you go back to some of my previous videos, especially in the past couple of weeks, I've been talking about how bad corticosteroids are for our joints and our tendons and our ligaments. And that's just one injection. She had 7 over the course of the past 10 years, maybe less. She said, yeah, they work great. And then when they wear off, I go get it again. Well, now she has severe arthritis, severe in multiple parts of her shoulder. She has severe tendonitis and tendinopathy, and possibly torn rotator cuffs and a torn biceps tendon. This is a prime example of an individual that should have came to see someone much sooner. I don't mind giving a steroid injection if and absolutely when it's needed. Usually that's at the beginning of an acute injury. But if you have continuous chronic pain, the repeated injections are so detrimental to the body that it's going to cause more tissue damage and it's going to cause more problems. And then at the end of the day, you're limited to specifically one solution, and that is surgery. When she came in, I told her, "I wish you would have come to me sooner because we could have talked about regenerative medicine, platelet-rich plasma, maybe some micronized fat, maybe some bone marrow aspirate concentrate injections for her to really help that shoulder." Her pain now is 10 out of 10. She can't move her arm, and she's essentially looking for the next available surgery date that the surgeon has. Is this something that could have been prevented? At this time, yeah. We could have easily prolonged the half-life of that shoulder and given her a better environment. And sometimes that takes a proper physical therapy environment, not just an injection and see you later. If you do the steroid injection, the rehab process after the steroid injection is probably more important than the steroid injection itself. On top of that, if we identify the problem, we should be focusing and looking at regenerative medicine options such as platelet rich plasma, micronized fat, bone marrow aspirate concentrate to help restore function, decrease pain, and potentially prolong any surgery that might be needed for that. And in some cases, knock on wood, prevent surgeries, which we have seen in our practice and other practices across the US. So that's another time where it's important to not put off your pain. Go look for other solutions that might be available for you. Go talk to other physicians, go talk to other colleagues, go do some research because I think it's important to know that there are other treatment options available. And this is another case where a patient could have benefit from seeing a regenerative medicine specialist or a well-trained musculoskeletal expert. And the last case I want to talk about is a very interesting one as well because this patient was actually referred to us from their physical therapist. And the physical therapist was saying, yeah, his pain gets worse when we're doing physical therapy. And it's not getting better in the grander scheme of things. I think there's something more serious going on, but I can't help him with physical therapy at this stage. So I'd like to refer him to you. Well, when this patient was called from my team, the patient said, no, I think I'm just doing too much. I want to rest. I want to relax. Well, I think that's another disinformation piece that we have on healing. More rest, taking it easy, those kind of things actually cause an inflammatory response that is catabolic, meaning it destroys the joint, it destroys the tissue a little bit more. That sedentary lifestyle doesn't allow the proper macrophages, the proper growth factors to get to that area to help rebuild. So I'm not sure why this patient felt like that's what he's needed, but it's very interesting because he again would be an individual who probably would have benefited from seeing us much sooner in the rehabilitation process and not just putting it off, putting it off, putting it off. And then when he gets the referral, say, no, no, thank you. I'm okay. Here's what I fear in that situation. This patient is going to go the next 4 to 6 weeks without the proper treatment. He's not going to be able to do his physical therapy. He's not going to be able to stay active. And his whatever his condition is going to get worse and worse and worse. And as it gets worse and worse and worse, his options will be more and more limited. And that limitation looks a lot like surgery at the end of the day. So those are really the big talking points I wanted to bring up today that I think it's important that you get your musculoskeletal checkup sooner than later. If something's bothering you and it's been bothering you for more than, we'll say, 6 to 8 weeks, even if it's very, very mild, I think it's important to go see a physician or a musculoskeletal health expert that's going to be able to give you a proper diagnosis, hopefully get you with the right therapist to work on these deficiencies, insufficiencies, maladaptive behaviors, gait patterns, what have you, to help prevent those surgeries that are going to come down the road. But even so, if there's something a little bit more mild to moderate, moderate to severe, maybe there are regenerative medicine treatment options available for you. And wouldn't you rather start having that conversation now? I'll close it with this because if I ever do a regenerative medicine procedure on a patient, and when I do them, I tell the patients that we need to prime the body. We need to get you metabolically active. We got to have all the toxins in your body to kind of get flushed out, meaning eliminating processed foods, decreasing refined sugars, decreasing alcohol or abstaining from alcohol, no nicotine and tobacco products, making sure on an anti-inflammatory diet, good stress management, good sleeping. All this stuff help builds up your ability to have a successful metabolic profile for when we do our regenerative medicine procedures, that you're going to have better results down the road. So if that is the case, when you come to me when your rotator cuff's already torn and you need surgery now, then it's too late, because these regenerative medicine procedures, they don't work right away. They take time to change the environment in your body to help heal, help restore, help decrease pain and increase function. So those are the big points I want everyone to take away from today's talk. And I think it's important. Go get checked out. Don't ignore it. The longer you ignore it, the worse the outcomes are going to be for you down the road. I hope you found this useful. Please drop some comments. Please send some questions to me. Please share with a friend and family members. And if you're in the Columbus area and you'd like to talk to me more and have a consultation, information's in the links below, and we'll talk to you soon. Take care. Bye.